Welcome, dear friends, to another episode of Pediatric Puzzles. This one is entitled Tiny Troubles Unravelling Pediatric Hernias. I am Dr. Vivek Vishwanathan, your friendly pediatric urologist, and today we are diving into the fascinating world of pediatric hernias. Picture this: your little one is like a curious explorer, and sometimes their body plays hide and seek with us too. Let's get to exploring. Segment 1: The hernia hunt begins. First up, we'll be discussing the two most common types of hernia. Umbilical hernia. Those little belly button surprises affect around 10 to 30% of children at birth. By the time they blow out their first birthday candles, the numbers drop to 2 to 10%. But in African populations, it's like a secret club. Rates vary anywhere between 23 to 85%. Imagine that. Inguinal hernias. Well, these are the stealthy ones. They sneak through the abdominal wall like tiny ninjas. And guess what? They are more common in boys. Watch out for that groin bulge. Now you might really want to know what's the anatomy behind the sneaky hernias. So let's break it down. Well, there's something called an umbilical ring. It's like a cosmic portal between the mom and the baby. After birth, the umbilical cord disintegrates, but the ring remains. Usually, it closes by the child's 5th year thanks to the abdominal muscle growth and some magical fusion. Now coming to inguinal pathways. These are like secret tunnels. Sometimes the abdominal contents just decide that they want to take a detour through them. Naughty, right? Now what are the signs and symptoms? Detective work time again. Umbilical hernia. Most are harmless and close on their own. Parents, be reassured. But if complications arise, we've got their backs. Inguinal hernias are the tricky ones. They can lead to complications. If you spot a bulge near the groin, don't play hide and seek. Refer for a specialist assignment. These can cause obstruction, strangulation, unbearable pain, and whatnot. And the diagnosis? Well, the diagnostic dance. Our tools, as always, include a physical examination. We generally feel for clues. Sherlock, as always, would be proud. An ultrasound is our magic lens to peek inside, where we don't need an invisibility cloak. Now, what are the surgical solutions? When it comes to fixing things, we can resort to laparoscopic repair, where tiny incisions yield big results. Open surgery, which is the classical approach, stitching it up like a pro. People in archaic times used to resort to something called a hernia belt. It's like a superhero utility belt for the abdomen, but it's not resorted to nowadays and it's obsolete. But I've just mentioned it here for namesake. There you have it, folks. Hernia are like riddles waiting to be solved. Consult your friendly pediatric urologist. Let's keep those tiny explorers safe. Thanks for tuning into Pediatric Puzzles. Until next time, stay curious. We'll be discussing inguinal hernia in detail in the next segment, so please stay tuned. Peace out.